Hello everyone and welcome to another audio podcast in this series, the ZtormTronix case review v.2. This is an audio podcast in relating to an overview relating to hematology and transfusion practices in around between 2017 and 2022, and it's a reflection on leadership and management. Once again, this is the Shientist, and this is part of a Storm Robotics production. So today I'm going to highlight some works and a sort of an overview in relating to works that had been published in a scientific journal under a remit in relating to leadership. This works had stemmed back from 2017, where works had been developed and formed sort of independent research in relating to considering renal health in those who potentially would need a red blood cell transfusion following, for example, where patients would be suspect of high risk for renal disease, where in addition they would have suspected anemia as well. So this work had been part of this work had been presented at the Biomedical Science Congress in 2017, and before the Congress, the works was independently developed and formed sort of research, and wherein around late 2017, the work had been put forward for peer review publication, and had actually formally formed a book publication. The works is again available through the Renal Patient Support Group, the RPSG, and so I thought what I'd do in this audio podcast is provide a bit of a synopsis in context of an overview that had been put forward to the scientific journal, and the works had been put forward in relating to a desperate need for good leaders. And so I thought I'd put an overview in this audio podcast relating to this. So some context then first. So chronic kidney disease is defined as the existence of kidney damage for three months or more, or an estimated glomerular filtration rate, or eGFR, of less than 60 mL per minute for 3 months or longer, with or without kidney damage. There has been developing research relating to health inequality and chronic kidney disease. A review on works in 2013 identified 30 symptoms associated with chronic kidney disease, and reported that the overall symptom burden is high regardless of disease stage. This symptom burden is acknowledged as the most important predictor of diminished health in patients with chronic kidney disease. Biomedical science is a dynamic and challenging profession requiring engaging and inspiring role models and leaders. Identifying and developing scientists leaders is one of the greatest challenges faced by the profession. And so the aims around this works was to formulate a biomedical stance on leadership and management in health today using a chronic kidney disease and red cell transfusion or RBT descriptive to highlight the importance of integrating knowledge and skills. Also to highlight why patient-reported outcome measures, or what are known as abbreviated as PROMs, patient-reported outcome measures, are going to become or have become more important, and why continual professional development CPD is important to improve foundation of learning. So now I'm going to highlight a little bit of context around biomedical sciences sort of today, open quote, close quote, today. So the Institute of Biomedical Sciences, the IBMS, aims to promote biomedical science and those who practice biomedical science through a variety of activities based on the premise that within its membership there is a unique body of knowledge that informs an examination and award framework for facilitating development and recognizing professional excellence. This enables the Institute of Biomedical Sciences to respond and adapt to challenging environments, scientific and technological advances, new legislation, and evolving roles. The Institute of Biomedical Sciences fosters a culture. The Institute of Biomedical Sciences fosters a culture of partnership and excellence to preserve a high quality and enthusiastic workforce that continues to advance biomedical science. So a bit of context now around chronic kidney disease and red blood cell transfusion. So patients with chronic kidney disease often suffer simultaneously from multiple symptoms related to the condition or side effects of medical treatment. These clusters of symptoms may exert an adverse effect not only on their physical health but also on their psychological and emotional well-being, giving rise to what is described as a symptom burden. While red blood cell transfusions were the principal therapy in patients who may be known to have renal insufficiency to treat anemia, their use is becoming less predominant. And so with renal function decline, this has an impact on overall treatment and care plans, and patients then potentially becoming untransfusible. Having a good knowledge base is critical, bearing in mind there are now more restraints in everyday practice. Recent evidence has emerged or had emerged that more restrictive red blood cell transfusions are safe and averts the potential harm associated with more liberal transfusion strategies. Now there should be scope to integrate use of patient-reported outcome measures to help support and develop future scientists, leaders, and managers, thus bringing biomedical practice more so to the forefront. So what are patient-reported outcome measures? So in routine health practices, patient-reported outcome measures are used as tools for benchmarking and hospital performance assessment. Patient-reported outcome measures also have the potential to assist in delivery of healthcare. In the United Kingdom, primary and secondary care records are being linked together so that patient background is more readily available to clinicians when required. The integration of patient-reported outcome measures data with routinely collected clinical data can provide opportunity for revolutionizing the healthcare system, enriching clinical audits, and assisting with the designing of pragmatic trials. Given the vast array of prompts in existence, it is crucial that decisions are backed up by the best evidence available, and this is where biomedical scientists can have a more integrated role with regard to leadership and management by understanding patient-reported outcome measures in context to biomedical sciences. So a little bit around leadership and management. So being a leader in the biomedical science profession requires scientists to demonstrate integrity, but equally scientists should be encouraged to have more constructive dialogue with their multidisciplinary colleagues. So those who make red blood cell transfusion requests, for example, know when it is safe to transfuse patients who may have renal insufficiency or at risk of acute kidney injury or AKI. Leadership is also knowing when patients may benefit with alternative treatment or care pathways, and then there need to be good examples. There needs to be good examples in practice, so colleagues can gain first-hand experience of what works and what doesn't. There needs to be more compassion through mentoring and training. Otherwise, the motivation relating to training and development lacks enthusiasm. Management alone does not allow pathway in practice for fellow colleagues to follow. There is a desperate need for good leaders to link standard operating procedures and encourage evidence-based learning and practice. Perhaps another example of where leadership is required is highlighting chronic kidney disease and the science behind blood and organ donation and transplantation to the general public. So a little bit now around the importance of continuous professional development. So continuous professional development, or CPD, perhaps forms the backbone to all major health professions. Scientists should also contemplate being involved in advisory and steering groups to help enhance healthcare more widely and provide best practice for patients. Scientists must be thinking unilaterally, especially now with the emphasis on patient-reported outcome measures. Continuous professional development is also about how scientists should seek to highlight and publish their efforts. It is important to improve the foundations of learning, and this should actually be encouraged at all grades. A little bit around this in context of discussion, and then some conclusions. So that scientists are needed who can contribute through multidisciplinary efforts using evidence-based practices, thus shifting the paradigm of leadership and management, and wherein future practice is destined to grow. It is essential to future success that leaders possessing positive qualities are identified and nurtured to lead and manage the profession. In conclusion, it is obvious that chronic kidney disease is increasing owing to health and social concerns, and certainly there is to be more balance. Surrounding equity and impartiality. Thinking more unilaterally, there is an increasing need for good leaders in science. In today's ever-changing and demanding healthcare, it is important to appreciate that patient-reported outcome measures will become increasingly more important and integrated in future biomedical sciences, supporting care of patients with long-term conditions and chronic illnesses. And finally, I want to say that this works, this overview is in dedication, in loving memory to a dear friend, Maureen Omondi, from 1979 to 2016. Maureen Amondi campaigned tirelessly for blood and organ donation, donation awareness, and fought her life through chronic kidney disease. Thank you for taking the time to listen. This has been the Shientist on this audio podcast relating hematology and transfusion practices relating 2017 to 2022. A reflection on leadership and management. It's been another Storm Robotics production in this series. Again, the ZtormTronix case review v.2. Thank you.